Hi, everyone. I'm here with Dr. Heather Kowalski. Dr. Kowalski is a pediatric orthopedic surgeon at the University of Iowa Stead Family Children's Hospital. Dr. Kowalski, can you share with us your background and the areas of clinical expertise that you have?
Sure. So I am a pediatric orthopedic surgeon, and what that means is I am an orthopedic surgeon who specializes in taking care of the bones and joints and musculoskeletal problems of children. So just kind of as a background, I am from Michigan originally, and I went to medical school in Detroit and did my residency or my surgical training in Detroit as well at Henry Ford. And then I did an extra year of training specifically in taking care of children at Cincinnati Children's Hospital. So I've been at the University of Iowa now for 7 years. And things that I take care of are any kind of musculoskeletal problem in kids. So things like broken bones is a lot of what I do. Kids with things like cerebral palsy or leg length differences. I take care of kids with scoliosis. I take care of kids with hip dysplasia. So kind of some common things that you may have heard of or known children that have had those kinds of problems.
And so when may a child need to see an orthopedic specialist for concerns? What are some things that parents might need to look out for to know when their child needs to see an orthopedic specialist?
It's a great question. So a lot of the common things that I see kids for, like I said, are fractures. Kids break their bones all the time, unfortunately. And so a lot of those things, if the fracture is a pretty straightforward, not too far off and lined up well, then a local orthopedic doctor would be able to take care of that. However, if it gets to involve a growth plate or is just something that the local general orthopedic provider isn't comfortable taking care of, those are things that would then come to see me as a subspecialist pediatric orthopedic doctor. Some other things that parents frequently see us for are if they have a baby who's born with hip dysplasia. So a baby who has one hip that's unstable or coming out of the socket, or a kiddo that has scoliosis or a curvature of the spine. Those are the more common diagnoses. Other things, if parents notice a limp or they notice that their kid seems to have one leg that's a little bit longer or shorter than the other, that would be a reason to come see us. Or I see a lot of kids for things like toe walking. So it's really common for kids to walk on their tippy toes. However, if it persists into kind of childhood and into school age, it's not uncommon for me to see a kiddo for something like toe walking.
When is toe walking and stuff like that? When does that become a problem for
That's a
kids?
great one. So toe walking really doesn't become a problem unless kiddos lose their ankle range of motion. So if they can still get their heels flat on the ground, we don't worry about it at all because it's not known to be associated with anything else. But kids who walk on their toes and can't get their heels flat on the ground are the ones we worry about. And then often there are very relatively straightforward treatments that don't involve any kind of surgery, but stretching and casting and physical therapy that are really effective. So I am a mommy myself, and I think that gives me a unique perspective on taking care of other people's children. I have two little ones. I have a 3-year-old son and a 17-month-old daughter. And it has given me very much better appreciation of what I'm putting parents through when I take care of their kids. Things like putting someone in a cast used to be very benign before I was a parent. And now I realize you can't give that kid a bath, which is kind of a challenge when you're a mom. So I think it gives me a very unique perspective. Also, I do outreach clinics. So I am in the Johnston area at the University of Iowa Johnston facility once every month. And I also go to Child Serve and do a clinic there through the university also once every month. And so I'm out in Johnston twice a month. So we are accessible if there are specialty needs from the standpoint of pediatric orthopedics.